and welcome to another episode of GaiaHealers and researching the most amazing technologies that are out there for health and wellness. In today's episode, I wanted to introduce Dr. Francisco Cidral. He is an amazing researcher and scientist that I'll have him introduce himself with his background and powerful ways that he's influencing the science of natural medicine and functional medicine. So today I wanted to have a conversation about these new technologies.
First of many.
Yes. that we will be bringing and introducing to you guys. But today is the day for Biotech now. And Dr. Francisco has introduced me to this very, very powerful technology that we want to have a very amazing conversation. Dr. Francisco, please introduce yourself so that our audience knows a little bit about your amazing background.
Okay, first of all, thank you for having me here. This is very
Great
good.
to have you.
Pleasure. I'm always very excited to talk about things that are going to revolutionize the way that we see our health and wellness.
That's right.
So my background, I'm a naturopathic doctor. Then I did that in Brazil. That's where I'm originally from, and Italian Brazilian family. And I first, it was a 4.5-year full-time program for naturopathic medicine down there. And then you do another 2.5-year specialization. I did acupuncture. Never really liked needles very much, which is kind of weird for an acupuncturist. So I started using laser acupuncture instead. And then I fell in love with photobiomodulation as a whole.
Okay.
After that, those 2.5 years specialization, the university called me back to teach in the acupuncture post-graduation program and in that naturopathic school as well. So I was one of the supervisors at the residency program that we have afterwards.
Okay.
And I was seeing the results of photobiomodulation, but I didn't really understand all the mechanisms behind this. This is like, years and years, like decades ago.
Okay.
Not even go there. But I wanted to understand the mechanisms. And then I was lucky enough to get a full blown scholarship to one of the top medical institutions there in the country.
Okay.
One of the best in the whole South America. And I got into the neuroscience program. So I got a full scholarship so I could stay the whole day in the lab. So it was doing experiments. So it was a 2-year master's. And then after that, I got another scholarship, like a 4-year PhD. And then after that, I did a 1-year postdoctorate. And then after that, they told me,
you got enough.
Go do something else.
Go work. Go help people.
I went back. I mean, that all together, man, I was like 14 years, studying. So then I went back to the university and then I started teaching neurophysiology.
Okay.
And I've been a professor in neurophysiology ever since. I'm still an associate professor at the lab. And 14 years ago, we founded the Lab of Neuroscience at the university. I'm still associated there. I supervise students going through their master's and their PhD. That is in the south of Brazil. I'm also an associate professor at the University of Sapienza in Rome.
Okay.
With Dr. Gianluca, who's our partner, our friend,
Yes.
from Italy, from Rome, functional medicine doctor. And then here in the US, we teach at the Integrative Open Institute, and we have associations with a lot of different universities. So
amazing. Thank you for your extensive background. And as you guys can tell, Dr. Francisco is all about research and finding other technologies that we can naturally help the human body to achieve its optimal health and wellness. So tell us a little bit about biotech now. Why are you really fascinated about biotech now? You introduced me to it. I'm fascinated with it now. But please give us a little bit of a background about this knowledge or the technology and how this came into your radar.
So the first is the credibility. They've been around for more than 30 years.
Okay.
And they're very, very serious about research and development. This company is fundamentally research. I mean,
Okay.
they're from Italy, and the biomedical engineer that developed all these devices, I have to say, he's a genius in physiology. When I go watch see his talks, and I still do, like I study with them on a regular basis. Sometimes I have to go back to Guyton to learn a little bit about what is he saying. And then you go into the book and it's like, yes, it's there. It's just incredible the amount of knowledge, that they have put together into these devices. And nowadays, with the way that they've been collecting the data for more than a decade, with AI and the way that you can aggregate all these different data points, they have more than 40 million assessments that they can calculate, and then they can tell you exactly where you are in comparison to the rest of the updates that they have. They have like more than a dozen publications in A1 scientific journals. These devices, they have been used by top research institutes internationally Like the person that developed the whole concept of osteosarcopenic obesity, for instance, which is a very well-recognized professor here in Florida, Dr. Jasmine Neely, she used these devices. So it's just a wealth of information. I've never seen anything so well put together in terms of health and wellness, non-invasive assessments in all the years that I've been teaching and that I've been working in this field.
Okay, and like it looks like we have a whole army here.
Yes.
Can you tell us a little bit about like what is the big picture? What are we trying to achieve here with this group of technologies? And then we'll dive into the each one of them to talk a little bit about them.
So we know that the most serious problem that we have nowadays is that we have no real good way of like fighting back chronic diseases, right? Mm-hmm. Especially when they're considered subclinical. Like you don't have a specific diagnosis. You say like you go and take a test, and then if the limit for that particular disease is like 30 and your number is 28, you don't have it. You don't need to do anything about it. We know that that's not the case, right? Because we have to look at health as a chronic, like a continuous. And right now, the way that the biomedical model is looking at these things is very interesting, but they're highly specialized. And we know that individuals are different, and then your numbers may vary. So how interesting or important would it be for you to know what is your real health state? And what are the things that are influencing it? What are your numbers in comparison to 40 million different assessments? And how can you reverse this process? Because we're talking about function. That's pretty interesting, right?
Absolutely. So we're talking about more keeping people well instead of you having to wait until you have symptoms down the line. That's my understanding from this technology. That's going to help people stay more into their optimal zones without having to deal with serious things in the future.
And this is preventive. This is comprehensive, medicine. And this is all of what naturopathic medicine is. I mean, right? You're not looking at fighting specific symptoms. You want to see how the body is reacting, how the physiology is managing with all the situations. And then you're pinpointing, give you people numbers, and then saying, how can I reverse these numbers? Here are the things that you need to do. And these devices combined, they can do all of that.
Now, are these devices here, are they FDA cleared? Are they like the devices that will make any?
They're medical device class 2 in the health and wellness space.
Health and wellness space, okay.
Remember, we don't want to treat diseases. Exactly. That's not how we treat people. It's not your disease. You are not the disease. You are a combination of physiological processes that we can modulate and we can reverse when things are not going the right way. I don't really care if you have diabetes or this or that for this type of treatment. That's not what is important. What's important is how your physiology is responding and how can we reverse that.
And how we can create that environment for the body to be able to respond and create that wellness within itself.
That's it. The good news, we can tell what it is. The bad news is you got to do certain things and generally has to do with some habits that we develop. So this is suggesting lifestyle changes.
Okay.
Right? Hydration, nutrition, exercising, but it tells you precisely.
So can you give us an idea of like which one of these devices in what way? I just want us to draw a picture, an image for our audience so they can understand, okay, like if I do this device and this device, that's the kind of information or that's how it's going to help me. So if you could, maybe we can start from the first device that we have here.
Okay, that's the egg, right?
Okay.
So imagine this. Most of the problems that we have nowadays, they started with stress, right? Stress is a physiological process that is very important. I mean, you need to react to situations. Like, there's a bear, classic example, and you need to either fight with it or run. I'd recommend that you run.
Absolutely.
That would be the recommendation. For you to be able to run or to fight, there is a whole set of physiological changes that happen instantly in your body. Right? This is like a reflex. You don't need to think about it. Immediately, you start to see better. And then the blood that is doing our digestion and everything else goes into the muscles. And then, so prepare for you to run. And then there is like a release of glucose in your body so that you have the energy to do it. And then, you're ready, your muscles are ready, and then everything's fine. And then you breathe faster so that you have the cardiorespiratory capacity to do it. And then you run. And then after that is done, then you relax.
It goes back to normal.
That's it. It's beautiful, right? We would not be here if it was not for this system.
We wouldn't be able to evolve as a human
The classic flight or flight system. The problem is it can be a real bear or it could be an imaginary bear. That's the same type of response. And then you have this happening when you see a phone call that you don't want to talk to this person, or you didn't answer the email, or your wife told you something that you forgot. That happens a lot. Those types of things. And it happens one on top of the other. So you never get that recovery, that rest. You're in chronic stress, constant stress. So imagine that in a stress situation, do you need to have all your resources to create new things, improve your creativity, write an essay, read a book, talk about physiological questions? No, your brain is equipped to do that. And this is the frontal part, or the frontal cortex, or the prefrontal cortex is the one that is related to that. So the blood flow goes in there, you have oxygen metabolism, because this is when you're reading a book and thinking about it, or reading the news, or discussing a topic. In a situation of stress, you don't need to do that, right? So what needs to be activated is your response systems, is your immediate fight or flight mode and everything else. And now imagine if this keeps happening over time, all the time. And what happens with your prefrontal cortex is it doesn't have enough oxygen, doesn't have enough blood flow. And then this person is in chronic stress. And you also know that probably they start developing over time brain fog. They can't concentrate for a long period of time. And if you keep doing this over your years as you get older, what happens, you go into cognitive impairment, and then early onset dementia, Alzheimer's, Parkinson's, because you're not addressing the problem.
Exactly.
This device is a device that uses the technology for infrared spectroscopy that it places sensors in the forehead, and then it measures blood flow and oxygen metabolism. So I know if your prefrontal cortex is working well or it's not, or if it's in a state of chronic stress or not. So that alone is pretty interesting. So I can tell you if your brain is okay. Right?
Okay, that's huge.
And I'm not saying that you have a concussion, that you have dementia, that you have Alzheimer's. I'm just looking at the function, because I want to change the function.
Different hemispheres.
That's it. So after I do that, then I know, okay, let's stimulate the brain with a game or with something, whatever. Like different games, different tasks, different things that you can do. And the device guides you, because this is a neurofeedback device. Not only measures, it suggests what you need to do, and then gives you the exercises. And while you're doing the exercise, I'm looking at real time. Is this answering? And this is what we generally see. Like I give you an exercise, and then your brain starts to bring, flow to this area, and then it increases metabolism. The device tells me, and then I know for a fact that this is not a physical impediment. It's just functional.
Okay.
Now imagine if you now repeating these exercises every day in your house, for instance, right? You download the app. I send these exercises to your phone.
Does that device come with an app that
the whole system is integrated into an app? All the different devices, they come into one central location so that it can do correlations of the different data that I get from you. And then I can know much better, where you are from a state of, chronic stress and degeneration and everything else, or performance.
And the app works just with one of the devices, right? They don't have to have all the devices to use it, right?
No, they don't. They don't even have to have the devices in a way, but they should, because why wouldn't you?
Exactly.
All right.
Exactly.
But anyway, so you can send your patients the exercises to stimulate their brains every day.
Okay.
And then they can come back to the office, and then you can reassess them and see what's happening.
Can you give them homeworks at home so that they can do different kind of maybe games that the app produces, so they can? Oh, that's awesome.
Exactly. Okay. That's how it works. Some people also use this device, like psychologists or people that work with neurofeedback. They only use this device, and then they have their patients come on a regular basis to the clinic to do brain exercises. I mean, that alone.
And I mean, a powerful, healthy brain is a powerful, healthy system, right? I mean, the brain is the operating system, is a master. So if we can bring more energy to the brain and help the brain function better, then the entire system is going to benefit from it.
That's it. But now let's say you're in a situation where I look at your brain and then I see, well, there is a decrease in metabolism, oxygen metabolism in your prefrontal cortex. There is, over the course of the test, it takes 5 minutes. 5 minutes.
5 minutes, wow.
And it takes 2 seconds to set up because it's just place the sensor. That's it. You know, like I'm used to working in the lab with EEG systems that take me like 15 minutes to set up.
Yeah.
By the time I finish setting it up, the patient is already like bored to death.
And the sensors that you put in on the forehead, what kind of sensors are those? Is it like a laser?
A laser, yeah.
These are 2 laser sensors?
Spectroscopy, yeah, correct. To the little lasers that the first one measures where the flow is, and then the second one measures the flow itself, the amount.
Okay.
And then I have the numbers there. And then, like I said, I can give you real-time exercises and see how your brain reacts.
So we're going to go in a lot more in depth on each one of these systems, but we just wanted for this video to have introduction of this new technology that we were very fascinated about. So we talked about the brain, the importance of the brain, of how that technology by itself is going to really help us to benefit from that aspect. Now, can you give us a little bit idea of how the other systems are used in combination so that we can get
it's the whole system is combined because it's looking at the physiology of your whole body and how the stress system is affecting everything. So if you have chronic stress, I mean, you have top-down regulatory pathways. Your brain controls how your autonomic nervous system is reacting, right? That makes total sense. So the second step up is it starts over here. Then it goes into the modulation of the system that we talked about, the fight or flight mode, the sympathetic and the parasympathetic, right?
Right.
And these two, they actually modulate your heart and your heartbeat. And by looking at the way that your heart is beating, you can look at the state of your autonomic nervous system, sympathetic and parasympathetic. And so that's very important to know.
Absolutely.
If you have chronic activation of the sympathetic, then you're in chronic stress. Then now you have like impairment in your prefrontal cortex, and now you also have chronic activation of the sympathetic, then that is very concerning, right? And you can break it down into parasympathetic, sympathetic, and then a system that's called VLF, which has to do with chronic activation of this system. And this device tells me exactly what it is. So this is a plethysmographic analysis. I put the 2 finger sensors, takes a few seconds.
Okay.
Click on record, and then 5 minutes, you have the whole assessment. So it's super fast.
Is this technology here? Is that
that's
what
the
we're talking
PPG.
about? The PPG stress flow. Okay.
Correct. So that tells me about that. But because it's looking at flow, right? It's a plethysmographic analysis that looks at differences in volume of blood in this case, that is modulated and regulated by your heart, which then is regulated by the autonomic nervous system. So I can decompose the signals and look at that. So it also looks at circulation. So I know how your circulation is.
Okay.
And through the plethysmographic analysis, I can also look at what's called capillary permeability, which is if you have increased capillary permeability, that means you have a chronic or an acute inflammation in your body. So I could tell you about levels of inflammation with this device as well.
That's powerful.
So this is a neurofeedback device. This is a respiratory biofeedback device, because not only it measures, but I can then give you respiratory exercises, as you know, forms of breath work, pranayamas, and all that, helps modulate the autonomic nervous system. Is the only voluntary, right, thing that you can do to modulate that. And we can do the exercises with the device and then show real time the progress. It's just incredible.
And is the system actually sending biofeedback to help the system to correct itself?
It's just showing you, this one is just showing you how the autonomic nervous system is reacting to the different breathing exercises that it proposes.
From the breathing exercises.
But the nice thing is, like this one, I can send the exercises to your phone for the patient to do at home. This one, I can use this little device that the patient gets.
Okay.
Right? They put the sensor over there.
Yes.
They connects to their phone. And then the same exercises that they do at the office, they can do at home.
Oh,
and
that's powerful.
every time they do it, I receive, as the clinician, the practitioner, I receive a report. So I know that you did your exercise and I know how well you went in your exercise.
And what does this get connected to? Does it connect it to their mobile app?
To their phone, yeah. To their mobile
phone.
app.
So wirelessly connects to their phone.
That's it.
And it will have the exercises, they'll complete the exercises, and it will come to your
Yes, the exercises that you selected for your patient as a practitioner. The intensity, the amount, the days, the times, everything. So you know if they're compliant or not, because every time they do it, you get a full report.
Oh, that's very nice. So this way we can stay on touch of our clients every time they do their practice. We can make sure that they're doing their practice while we're assigning it, because if they're not, then we'll know about it. So this give us a beautiful opportunity to be on top of their health and wellness.
So
Now, how about their nutrition? Can this do anything about their nutrition as well?
not yet.
Not yet. Okay.
So that's the next step up. So imagine chronic activation of the stress system. Your brain is not working very well, sending signals, the stress signals, down to your body to activate your sympathetic the whole time.
Okay.
How does it get activated? It has like a whole neurohormonal response that is launched by cortisol, right?
Mhm.
As we're familiar with it, cortisol is a catabolic hormone. It starts to degrade things, especially during the night,
Yes.
and leads to inflammation. And the cortisol has a rhythm. Starts at high in the morning and then it goes down.
Okay.
Now imagine if you're always activated, it turns into what's called a flat high. So the cortisol, instead of doing this and coming down, it goes like this and then stays like this overnight. People don't sleep well. They get worked up during the night. They don't recover well because they had the stress system activated over time, And then over time, what happens is, and this is very sad, is we start to lose bone mass, we start to lose muscle mass, and we start to gain weight. Remember, every time you get stressed, you have like glucose dumped in your body. And then that starts to accumulate. And then we overeat it to compensate. And then we don't exercise. And then we sit down the whole day. And then these things start to change our body composition. The next device is measuring that.
Okay. So tell us more.
The
How does
stress
that help?
started here, went into our autonomic nervous
So-
system, and now,
We got the brain, we got the heart, and
And-
respiratory system, and autonomic nervous system.
and the rest of your body now.
And now is the rest of the body. Okay. Please tell us more about this.
So that's a classic bioimpedance device.
Okay.
But this one is very special because they were able to do a series of studies with thousands of people. Like, I'm not saying like a study with 10 individuals, I'm saying thousands of people,
Okay.
right? The first study that they did is compare this bioimpedance device with a DEXA device that is really expensive, very, difficult because size and everything else is invasive, right? And the results from this device to a DEXA are more than almost 97% correlation. So,
Very nice.
but this one takes literally 10 seconds. Set it up, 10 seconds. It shoots from your hand to your feet, hundreds of different signals. And as you can
So
imagine,
there are 4 electrodes, right? That two of the electrodes, they sit on the hand, and 2 of them are connected to the one of the.
that's
right?
it. That's it.
Okay.
Yeah. And now imagine like every different type of tissue in your body conducts electricity in a different way because they have a different structure, right? Bone conducts it, different than water, than muscle mass and fat and brain mass and everything else. So they're all different.
Different frequencies.
So this device is doing that and then collecting all the numbers and then tells me this is how much water you have. Are you hydrated or dehydrated? Is the water inside of the cell or outside of the cell? If this too much water outside of the cell, another study that was conducted showing that there is a correlation between extracellular water and C-reactive protein, which is an inflammatory marker, inflammation. So it tells me the level of low-grade chronic inflammation.
Wow. Okay.
Right? Like a very famous German scientist developed this concept, and he's still working with, guess which device?
The same device.
It's the same device.
And what is that called?
This is the BIA.
BIA.
Yeah. Mhm.
Okay.
So bioimpedance analysis.
Bioimpedance.
So it tells me about all your different body compositions, tell me about hydration, tells me about level of low-grade chronic inflammation. And then there is also a correlation, that was another study that was published, that shows a relationship between your cortisol, if it is circadian, if it is flat high or flat low, and phase angle, which is a marker in itself is very interesting because that's phase angle has to do with integrity of cells, of the cells. And this detects that, but it tells you about if you're a circadian or not and what you need to do.
And I know a lot of researchers, they're usually looking for a technology that can measure the voltage of the cell. Now, is phase angle and the voltage of the cell, can that be?
It's a little different. Like phase angle has to do with the integrity overall. It has to do with the fact that the electricity goes in or out.
Okay.
And how easily it does. And then it's actually like kind of a marker of cellular aging, if you will, and the physiology of your cell to that level. This device can tell you that. So now you say this has an exercise that you can do. This one has an exercise that you can do, right? This one is the only bioimpedance device that does circadian and cortisol levels, that does low-grade chronic inflammation. But then I can connect at the same time this device to the computer. The sensors are now, instead of placing in the hand and feet, I place them alongside my diaphragm, and it is a surface myographic device that measures how your diaphragm is contracting. So when I'm doing a biofeedback, I like a respiratory biofeedback, breathing exercise, I can see if your diaphragm is working with it.
Okay.
This is very powerful. And I look at coherence in your breathing and then how that modulates your autonomic nervous system.
That's big.
That's like a session like that. And then I can give this specific exercise that is the best respiratory biofeedback exercise for your patient based on the way that there is that coherence. That alone is phenomenal.
That's powerful. What else can we see? Can we see bone density from that?
We can see bone density, we can see muscle mass, we can see hydration, we can see water. And now, if I have a combination of these devices, then I know exactly how your whole body is. So that I can click on a button and say, what is the best diet for this person? With a click of a button, it gives you the diet. Say, what is the best type of exercise that this person should be doing, and what time, what kind, and what intensity, so that they can reverse, these problems. It gives you a physical reconditioning device.
So it's like a perfect biohacking tool to help you take off the years and start that regeneration.
Based on your numbers. It also creates 2 additional assessments that are just phenomenal. It tells me about your osteosarcopenic obesity index. Sounds like a very weird name, but osteo, bone, sarcopenia has to do with low muscle mass. Obesity, everybody knows, right? We're going through almost everybody.
Yeah,
it's that problem, unfortunately. So you combine those things, you have the most predominant syndrome now in the world is that. And that's the underlying cause of all chronic diseases. They all start like with the loss of function, right? Don't you agree?
Absolutely.
First thing, all chronic disease, loss of function. Persistent. You start to have alterations over here, and then your autonomic nervous system, and then your body composition, and then you develop all the other chronic diseases. This device, they measure all that, and then they give you a number. Where are you in this process? Not only where you are, but to tell me, these are the leading factors for you. And how can you reverse?
Now, let me ask you
tells
this.
you how.
Can this give us information about the biological age?
Now it can.
That's powerful. So we can actually tell a person that what is their biological age compared to where they are, and see how healthy.
So this is a new marker that is being implemented right now. Right.
And that's what I love from the conversations with you about the company, that they're always researching, they're always coming out with new ways that's just being added to the software.
Doesn't stop. But how powerful is it for you to know in this whole process? I don't have a disease. I don't have any diseases, but my index is not that good. I need to lose some weight. I need to rehydrate better. I need to do this type of exercise. I need to eat this thing or that thing so that I can reverse that process. This tells you exactly what it is.
Yes.
It's really powerful. Right? So anyway, these are the ones that tell you the whole picture and already gives you a lot of indications.
So now in shorter terms, just, so everybody's staying with us. I know we're covering a bunch of information. The first one,
brain analysis.
Brain analysis is the HEG, as for brain analysis, and giving homework so they can do video games or different types of games that will help with their neurological feedback. The second one was related to their autonomic nervous system, their HRV.
Yep.
They can have this monitor that they can send with their customer home that will connect to their mobile app. And now the practitioner can kind of give them guidelines of how to work on themselves and receive feedback from them in real time.
Real time.
So that was this technology. And now we went over
body composition analysis.
The BIA, which is a bio impedance analysis. So this was more about looking at the localizing inflammation in the system.
Not localized.
Okay.
This one looks at the whole body.
Okay.
If you want to know about localized, okay, let's say that this tells me that you have a lot of extracellular water. That means C-reactive protein, chronic inflammatory
process. So we're looking at the overall system.
Yes.
Okay.
But I want to know where exactly.
That's where we go to the next one.
we're skipping this one. Let's go to this.
All right, let's
This-
switch it. So
let's switch.
that comes in. We're gonna bring this one here, bring this one here.
That's the Tomax. This one is, you have sensors in your head, your neck, your back, your hand, and your feet. And it's sending this type of signals that this one does through your whole body to each one of those areas. So it separates the body in 34 different areas and tells you exactly oxygenation levels, pH levels, reaction levels to that area, and
Okay.
tells me what's called general adaptation syndrome, developed by Seeley many, many years ago. In physiology, everybody knows what that is.
Okay.
And it is telling you where the problem is. So I know exactly what are the areas that are affected, but it doesn't stop there.
And it starts to actually correct.
It corrects it. It's a
God.
it's a biofeedback device that uses low grade, very, very microcurrent,
Microcurrents.
which
Okay.
is, that's the level that you need, right? So microcurrent to correct that problem. And then it starts doing that. And every session is 100% custom tailored to you, because it's reading your numbers and then telling you this is what you need, and then doing that correction.
Now, what is the difference between like this technology than, let's say, another microcurrent technology that's out in the market?
A lot of them, they don't have sensors to know what's happening, right? Microcurrent is very good. Don't get me wrong. It's beautiful. You could do it like, that's one of the best, because if you have too much, then you're overpowering the system. Microcurrent is how your body is communicating.
Right.
So it has to be micro. The problem is, where do you treat yourself? For how long? And what are the specific frequencies and everything else that you use? You don't know.
You don't know.
You don't know. This tells you, because it's
Automatically.
reading automatically. It's reading, correcting.
That's powerful.
That's very powerful,
Okay.
right?
Yes.
Very.
So that brings us to the last but not
last
the
one.
least.
That one
So-
is for the users of BioWell. I think that one is phenomenal.
So yes, so this is called the Regmatex.
Yes.
And tell us a little bit more about the technology behind the Regmatex and how we can use the Regmatex.
So that's an electrodermal biofeedback device.
Okay.
So it measures the pulses of electrical pulses that your body is naturally emitting, right?
Okay.
You know that everything communication with the nervous system has to do with electricity, right?
Absolutely.
We're electric beings.
That's
You know, Dr. Tannen talked a lot about that.
Health is
voltages,
voltage, yes.
That's it. That's what it is. So this device is measuring it
okay.
in all different ranges, and then it's giving you. You don't even need to think too much about it, because it's measuring, and then it knows the optimal parameters for you. Especially if you did these devices before, because your information is in the system. So when you connect this device,
That
it
will
captures
automatic.
all the information from these, and then say, based on the way your brain is, your autonomic nervous system is, and your body composition is, this is what you need, and guides you. And then you do the session. It indicates these are the sessions that you need to do.
So it's almost like dummy proof. You just connect it and you have the recommendations of what systems you need to
That's it.
apply, click, apply, done.
Or you can do a BioWell, and then you look, what are the systems that are off? And then you go into this device and I say, I want to give electric pulses to stimulate the liver, the kidney. You can be very specific with this device.
And BioWell is a technology we use. That's our favorite technology to measure the flow of energy in the human body. And this can be a very amazing complement to that technology, because on BioWell, we're just looking at what areas are maybe there's overactive or there's underactive.
Yep.
So then we can go to the library of the system, pick those systems out, and start actually helping you in real time.
100%.
Powerful.
Yes. But even if you don't want to do that, I mean, the device, like with the combination, they do the whole job for you if you want. And the interesting thing is, like the BIA that I can use together with the PPG and do a respiratory biofeedback, I can also connect this device with the PPG, or I could connect the Regmatex with the PPG. And at the same time that it is doing the microcurrent therapy, you're doing a respiratory biofeedback.
Biofeedback as well.
And it gives me the whole setup. So, I mean, have you ever seen anything like this before? I have
Not
not.
at all. Not as I've been doing a lot of research, as most of you guys know, with a lot of different technologies. But once, I saw you and I saw the presentation on this technology, I was really amazed, and I wanted to do a lot of research on it to see, how we're actually able to measure the changes. And it's been phenomenal that with all the research that we're doing so far, It's shown an amazing solution to a lot of different issues that we're looking to find solutions to. This is by far my favorite, the PPG and the at-home device that we can send with our customers home. We've done a lot of research on that, and customers just love that customization and to be able to have somebody that is like a guide that's on top of them every time that they, they use the system. The information is sent to the practitioner, and it just makes it a very beautiful way of communicating with our clients and having a way to support them even at times they can't come and visit our office, or something else happens in the future that is keeping us away. Then these are very, very powerful ways that we can bring into our toolbox to help our customers and clients and maintain their wellness. Dr. Francisco, thank you so much for your time here. This was a very amazing introduction. Is there anything else that you want to add into this session for our audience?
Well, I think that we have to think from a global perspective, right? So forget about diseases. We want to know how that is affecting your physiology and what are the underlying factors. With this, we can know what the underlying factors are, and we can say, look, in your case, all you need to do, you're in a chronic stage, is you need to lose weight this way. This is your diet. This is your exercise routine. This is how you need to implement it. These are the therapies that we can do to help you with that process. You need to drink more water. You need to do this, that. I mean, the device is telling you exactly. And we can use that as a tool to change habits that then are going to change life. And we're reversing cases of, chronic, like osteoporosis with 70-year-old people. We're reversing the process with life changes. Everybody knows that. Why don't the people do it? Because they don't know where they are. They don't know exactly what they need to do. And then people like to see the numbers. Here is your number. You started doing your exercise. You come back, I assess again, and I say, look, this got a little better. And so that stimulates people to continue. If they don't have that, they send blood work and it's going to take weeks to come back and whatever. I don't know. This tells me real time at the clinic, here is what it is.
Yes, and that's
it
powerful.
Makes a huge difference.
For them to visually be able to see how they're improving and how their markers are, changing for better. And, it keeps them wanting to keep on coming back. And, I've been using this in our own system with our own clients, and I'm experiencing it of how much extra client retention we're getting from it.
It's powerful.
Because they just feel that you have more ways of caring for them, and really wanted to help them in their own environment instead of just having to come to an office to feel better. Now we can help them in their own home, in their, among their families, and, they can share that with different family members, and, everybody can benefit from it. So I'm very, very pleased with this technology and the technology and the research that we're doing so far. So I can't wait to do more videos with you and dive even deeper into every single technology so we can share it with all the amazing people.
Pleasure.
Thank you for watching. We'll see you guys in the next episode.